good last here.
10 minutes.
Can I just start by saying that when I was first elected to this House in 1997, I did expect to be involved in debates on socio-economic issues along the lines that Senator Conway, a man whom I respect, has outlined to us. But in all my expectations, I never ever thought that I'd be standing here debating the most fundamental right, the right to life. In that regard, can I just say that it's with more sadness than anything else that I rise to make this contribution. The guiding principle that I've had throughout my life in politics, and indeed outside of politics as well, is that human life is inviolate. From conception to natural death, interrupted any way along the continuum, and the rest of that life is obliterated. Let me say clearly that a mother's life must be protected in all medical circumstances, including medical complications during pregnancy. Clear evidence from the health hearings was that the current medical practice is such that there are no inhibitions on our obstetricians and gynecologists treating a woman, and many of them actually, I think all of them, stated clearly that they never experienced personally or from their experience, any of their colleagues, a situation where they were inhibited by the law from doing that. So my concern surrounds the inclusion of Section 9, which is suicidal intent. Undoubtedly, suicide is a major problem within our society. The numbers of pregnant women, based on the medical evidence we got, is about 1 in 500,000. But in fact, I think a figure was given of 350 in every million young males commit suicide. So it's a huge problem. But we must practice evidence-based medicine. And there are no textbooks or medical journals which advocate that in any way abortion would be a treatment for suicidality. It is, as was said by people on the Health Committee and by some of the pro-choice psychiatrists, it's a treatment for an unwanted pregnancy. And I think therein lies our problem. I must say I've subscribed fully to our two-patient model of looking after both mother and child, which has served us so well in the past. And let me start by looking at the issue of protecting the mother. I oppose this legislation because it is anti-women. It disempowers women, and the experience everywhere is that it's women in the poorer socio-economic groups that are in fact disempowered. They're the ones that suffer most from this. It's also about men, let me say, who fail to take the responsibility. Post-abortion trauma, in a booklet written by Dr. Praveen Tevadasan, states that he describes it as the psychological consequence of repressed grief following an abortion. He attributes it to low self-esteem, may be a symptom of post-abortion trauma, but it may also be the root cause. Guilt may be a healthy sign that a person is gaining insight, and I'm quoting from him, into the significance of abortion. It will be accompanied by anger when the woman feels that the decision to abort was left, that is, made by other people. Guilt may be the beginning of healing, so those who campaign for guilt-free abortion are attempting to rob human beings of their very humanity. Suicidal thoughts are not uncommon and may be seen as unhealthy attempt to atone for the destructive act of abortion. Broken relationships are common following abortion. This is because the father and or mother may be silently grieving for the aborted child, and because either parent may feel let down, manipulated, ignored, spurned, even disgusted by the other. Anger is often directed at the father of the aborted child, at friends or other relatives who suggested the abortion. Flashbacks may occur. Some women have flashbacks when they pass any hospital or clinics where abortions are done. Some when they give birth to another child. Anniversaries of the conception of the abortion and the projected date of birth can produce sudden low moods. Alcohol abuse as a means of coping with the emotional pain of abortion is common, as are drug abuse, sexual promiscuity, and other forms of addiction. All this, let me say, was clearly illustrated by any here who took the time and the trouble to attend the various meetings at which Women Hurt attended. In 21st century, is this medieval barbaric procedure the best we can offer a woman who has an unwanted pregnancy and no doubt can be in very serious distress? The doctor to whom I referred gave case studies from his own experience. He talked about a 20-year-old student presenting with severe depression. She had had 2 abortions in 4 years. 35-year-old woman who has been cutting her wrists. Reason given is that at the age of 18, she was coerced into an abortion by her boyfriend. Cutting herself was a symbolic gesture of atonement for the destructive act of abortion. A 16-year-old girl seen after her 10th overdose. She's been feeling angry and depressed following an abortion. A 50-year-old woman is admitted with severe depression because of talking about the abortion she had 30 years previously. A 25-year-old man starts using hallucinogenic drugs in order, he says, to get in touch with his lost child. Some years ago, the actress Shelley Winters talked about her 2 abortions. She said, "I would give up everything. My money, my Academy Awards. If only I could have those children now." Gloria Swanson begins and ends her autobiography with lamentations over her aborted child. More recently, other celebrities, including Sharon Osbourne and Nicole Appleton, have spoken of their heartbreak after abortion. And the author says, as a nation, speaking about England, "We were profoundly moved when a young artist killed herself after aborting her twin babies. She wrote of how much she longed to be with them." So much for claiming that this legislation is about protecting women. But when we move on to the unborn, obviously, they have no chance whatsoever. And sometimes when we talk about abortion, people are very prone to use sanitized language. I refer you to Dr. Anthony Levatino, who's a US obstetrician, did as many as 1,200 abortions. Then, after his daughter died in a tragic automobile accident, he re-evaluated his position on abortion and stopped doing abortions. He told members of a congressional committee that they should support the bill that was going through, and he described in detail what an abortion is. And I quote, "Your patient has been feeling her baby kick for the last 2 months or more, but now she's asleep on an operating room table, and you are there to help her with her problem pregnancy. The first task is to remove the laminaria that had earlier been placed in the cervix to dilate sufficiently to allow the procedure you are about to perform. The first instrument you reach for is a French suction catheter. Picture yourself introducing this catheter through the cervix and instructing the circulating nurse to turn on the suction machine. What you will see is a pale yellow fluid that looks like urine coming through the catheter into a glass bottle on the suction machine. This is amniotic fluid that surrounded the baby to protect her. With suction complete, look for your suffer clamp. This instrument is for grasping and crushing tissue. When it gets hold of something, it does not let go. A second trimester D&E abortion is a blind procedure. The baby can be seen in any orientation or position inside, cannot be seen in any orientation inside the uterus. Picture yourself reaching in with the suffer clamp and grasping anything you can. Once you've grasped something inside, squeeze on the clamp to set the jaws and pull hard, really hard. You feel something let go, and out pops a fully formed leg about 6 inches long. Reach in again, set the jaw and pull really hard once again, and out pops an arm about the same length. Reach in again and again with that clamp and tear out the spine, intestines, heart and lungs.
1 minute.
The toughest part of a DNA operation is extracting the baby's head. You can be pretty sure that you've hold of it if the suffer clamp is spread about as far as your fingers will allow. You will know you have it right when you crush down on the clamp and see white, gelatinous material coming through the cervix. That was the baby's brains. You can then extract the skull pieces. Many times a little face will come out and stare back at you. Congratulations, you just affirmed her right to choose. If you refuse to believe that this procedure inflicts severe pain on that unborn child, please think again." Unquote. Colleagues, that is abortion. That is what you and I are being asked by this government to vote for. Good people in both houses are being coerced to abrogate their conscience. For your own peace of mind, follow your conscience and don't abrogate it to anybody. And I finish with this short poem written in 1969 by the late John Francis Collins and published by his brother. John wrote the poem following a newspaper report on the 22nd of May 1969 regarding an aborted baby crying out while on its way to the incinerator. A thought that is hard and abhorrent to contemplate. And the poem is, "Hear me, O God, hear. From the depths of my condemned cell I cry. None will hear me but you, because you see, I have no vote. I did not murder, nor did I steal or wound. Yet I am held here helpless before the sterile steel or the poisoned needle. A death too brutal for murderers is a death reserved for me. No comforting breast nor loving mother's arms await me. My body will be given to be burned. What have I done? I have not erred in this sordid, unlamented end. In sin was I conceived, unwanted I die, before I shall be born. Or when the mental enters my brain, when I shall kick my last convulsive agony, you take me to your arms." I'd ask those who may not have given it full consideration to reflect on what you're going to do later today when you come to make a choice. We have a choice. We vote for our values. We vote for life rather than the coercion of the whip.
Senator Terry Brennan.